The need for foster parents locally in the state of North Carolina and all over the country has been unmet for several years. What the pandemic did was exacerbate pre-existing needs that were already unmet. There just aren't enough foster homes anywhere.
Children and teens come in all shapes and sizes, and so do foster homes. So we need foster parents who are single, married, in between, retired, employed, people who rent their home, people who own their own home. And all of that equals safe homes for kids who need them to heal.
Thompson Child and Family Focus in North Carolina is making a difference in the lives of kids through a unique evidence-based approach.
We took a little different approach to meeting an existing need with adolescent teens in foster care, and that was by doing a national scan and researching what was already working with this population outside of North Carolina, and then bringing that evidence-based model into our state.
For our youth who have high level of need, we use an evidence-based practice called Treatment Foster Care Oregon, or TFCO. And a big component of TFCO is how we support our foster parents. They are heavily trained before a youth is ever placed into their home. They are supported once a youth is placed in their home, 24/7 access to our treatment team, weekly training. They are also compensated at a much higher rate than our other foster care programs. At the same time, we're also working with the family that the youth is going to return to, and we're mentoring them and supporting them so that when the youth graduates from TFCO, they're going back to a home that's equipped to handle their needs.
The training that foster parents get in the beginning is just a grand overview. And so most foster parents come out and they're able to take their first placement and be successful just with that training. But then the training you received after your placements begin and your licensing is granted can be very specialized. And so if you have a child in your home that has a significant mental health issue, then you can get training specifically for that. You just have to ask your providers.
Thompson Child and Family Focus is transforming lives through early childhood, family stability, and mental health services. This solutions-driven human services organization is committed to rewriting narratives for the most vulnerable through therapeutic foster care.
The therapeutic services that we provide at Thompson for both the foster parents as well as the children that they're serving are trauma-informed. They include wraparound case management services as well as evidence-based therapy services. And we do that with a lens to get positive life outcomes for the children.
TFCO believes that children get better in family-like settings in the community as opposed to locked settings outside of the community. So we really emphasize kids enrolling in public schools, getting involved in extracurricular activities, and just experiencing all the experiences that other youth would have in the community.
So as a therapeutically licensed parent, my husband and I are able to get all the training that we need through Thompson, whether it be through the medically fragile, connecting to nurses and medical providers, or therapeutically behaviorally challenged children with trauma. We're able to connect with clinicians. In the end, I can get any training we need to serve this child.
Discover how you can be a foster parent and make a difference in a child's life. Go to thompsoncff.org or call 704-536-0375.